Hello friends, my name is Dalit Soni and you are watching In Focus by Drishti IAS. In today's episode, we'll be talking about a particular crop which can be a reason for the various diseases, and ultimately in today's world it has become an endemic. Okay, so considering that, we'll be talking about the tobacco endemic in India. We will see how tobacco is impacting life of people. We will see how it is impacting the environment. We will see how it impacts the economy of the world, as well as we will see how it is taking lives of many people. We will see who are at the verge of these danger from the tobacco. So let's start our discussion. So today's point of focus would be, first we will go through the news, why we are discussing this topic. Then we will go to why tobacco is an issue. After that, tobacco negatively impacting the environment, we will talk about that. Then we will talk about the economic burden as well. Then the status of tobacco uses in India. We'll talk about some data, we'll talk about some trends, and then awareness and the control program. After that, we'll conclude the session with a MCQ practice question. Okay, so let's start with the news. First, here you can see that the tobacco endemic in India. Tobacco causes wide range of diseases and affects the people who are consuming it as well as those who are cultivating it. Okay, first, those who are consuming it, they are directly impacted by that. Second thing is, those who are cultivating it or working in the tobacco industry, they also absorb the tobacco through their skin, and that also causes diseases among them as well. Okay, so these are the people who are basically under the direct danger of tobacco use. Okay, there is a need to up-to-date data. Okay, so first of all, when we are talking about the data, the last data we have had, that is before 2019. After COVID, we have not gone for some kind of census with respect to the tobacco. So we need up-to-date data to understand the trends and to tackle the tobacco industry related issues. Okay, so that was the news, and now we will be talking about why tobacco is basically an issue right now. So when we are talking about tobacco, as I told you, this is most widely recognized preventive cause of deaths globally. Okay, so when we are talking about the diseases and deaths which are happening because of the tobacco, that can be preventable. When we are talking about the cancer is a disease which is happening because of the tobacco in various cases. So that is a preventable disease. If you don't go for the use of tobacco, there are high chances that you will not have associated cancers. Okay, so basically we are saying that it is a preventable disease, but it is happening in India because people are consuming it. Okay, in India, nearly 26 crore people are there who are consuming it. That is the data from 2016-17. Okay, that makes us the second highest consumer of tobacco after China. Okay, so China is the highest consumer and India is the second highest one. Okay, over 60 lakh people employed in the tobacco industry are at the risk due to the absorption of tobacco through their skin. As I told you, there are two ways: direct consumption, that there are many people who are directly consuming it. Second are those who are associated with the industry, and ultimately, since they are in the direct contact with the crop, then that is basically absorbing through their skin, and ultimately that will also cause some kind of damages. Okay, so there are chances that there can be skin cancers, etc. So these people are also at that risk. Okay, now coming to the next part, which is basically talking about the environmental as well as the economic burden. So first, let's see over here. A 2021 study estimated that the health impact of tobacco use cost over nearly 1.7 lakh crore rupees. Okay, that is basically 1.7 lakh crore rupees in a fiscal year of 2017-18. As I told you, we have a dearth of data. We don't have data after 2019. So basically we are still using these data. So that data says that nearly 1.7 lakh crore rupees are expended on the health because of the tobacco use. Okay, second thing is, the annual cost of cleaning up the tobacco waste is estimated around 6,367 crores. That is the amount which is to clean the tobacco waste with respect to the cultivation or with respect to the industry. Okay, then these estimates exclude the cost which is there to the, you can say, which is the cause, or you can say the harm which is caused by the tobacco with respect to the soil, like soil erosions and use of excessive fertilizers, etc. Other than that, since it is a crop which is remunerative in nature, okay, so people are going for the deforestation and then they are going for the cultivation of tobacco. So ultimately it is having such kind of harm on the health as well as, you can say, environment. Okay, now coming to the next part over here, when we are talking about the specifically environment things, here it depletes the soil nutrients. Okay, use of tobacco, or you can say cultivating tobacco crop, require many nutrients, and it will suck it up from the soil only. Okay, so that is one thing. There will be depleted, you can say that will be depleting these soil nutrients. Okay, second thing is, when nutrients are depleted from there, ultimately you will go for the use of fertilizer. Okay, so that will require more and more fertilizer, which further degrade the soil quality. Okay, so ultimately that will have a harmful impact on the environment. Second thing over here is it contributes to the deforestation, with up to 5.4 kg of wood needed to process 1 kg of tobacco. When we are talking about the industry, in the tobacco industry, there is no importance of these woods. They will be taking, or the chopping of the trees, nearly 5.4 kg wood will be requiring for the processing of 1 kg of tobacco. So that is the kind of impact it will have on the environment. Okay, so there are 2-3 things which we have discussed over here that can be important. You can extract these facts for your mains and you can use them. Okay, now moving further, let's talk about the status of tobacco use in India. When we are talking about this particular graph over here, that there are 2 periods which they have taken. They are given over here. When we are talking about the age of students, like 13 to 15 years age, there is a tobacco consumption there as well. So there are 2 data which is given in 2003 and 2019. Okay, so when we are talking about data 2003, there was high consumption and that has reduced over here. So that is one thing. When we are talking about the another chart here, that is about the people who are above 15 years age. Okay, and there are also 2 periods, 2009-10 and 2016-17. There also we have seen that there is also a decline over here. Okay, then there is the when we are talking about the men, 15 years and above men, in those also we have seen that there is a decrease in the tobacco consumption, and that data is from 2015-16 and second period is 2019. Okay, now coming to the next over here, you can see that this is a tobacco use of you can say woman, or you can say female, and here you can see that there is an increase. There is an increase of 2.1%. Okay, so here you can say that among all the other classes, we have seen that the use of tobacco is decreasing, but there is one section, that is particularly of women, where there is an increase in the use of tobacco. So that is a cause of concern for now, as of now. Okay, now coming to the these 3 different graphs which are given over here. One is from GYTS, second is GATS, and third from the National Family and Health Survey. Okay, so these are the details over here. When we are talking about global adult tobacco survey, that is for the people who are above the age of 15 years. Then global youth tobacco survey, that is GYST, that is for 13 to 15 years of age, and National Family Health Survey, that is for the individual which are of the age, or you can say above the age of 15 years. Okay, so these are the 3 data which we have studied. Now moving forward, here you can see awareness and the control programs. Okay, so we know that it is a problem, and that is why there are various programs at the national as well as the international level. First one over here is the WHO Framework Convention on Tobacco Control. With the name, it is clear that it is for the controlled use of the tobacco, or you can say reduce the tobacco use. Okay, it was launched in 2005. There are 168 signatories to this particular convention, and India is also one of them. Okay, then Cigarette and Other Tobacco Products Act, COTPA 2003. Original law was enacted in 1975. Then there was this amendment which has come in 2003. Okay, there are 33 sections which are governing the production, advertisement, distribution, and the consumption of tobacco. Okay, so there are rules related to production, there are rules related to advertisement as well. You know that when we are talking about the tobacco advertisement, there is a compulsion that they have to put a warning as well. Okay, so you must have seen the, you can say, packets of cigarette, etc. There is a warning which is displayed over there. Okay, so that is about the program. Then we are talking about the national programs. Here we have National Tobacco Control Program, NTCP 2007. It aims to improve implementation of the COTPA, which we have discussed just now. This is the act. So for the implementation of these last 2, we have this particular National Tobacco Control Program. Okay, focus on the raising awareness about the tobacco harms and assisting the cessation effects. Okay, now then we are talking about the tobacco taxation. There is this provisions wherein we are going for the taxation of tobacco, designed to discourage the consumption through increased cost applied in India as effective control measure. Okay, so we are going for the increase in the tobacco cost by increasing the taxes. Okay, what is the intention behind is that if there is a high cost, people might go for the reduced use. Okay, So these are the efforts which are being taken nationally as well as internationally. Now, what are the challenges when we are talking about the despite all the efforts? We are saying that tobacco is harmful. We are saying that there should be an awareness. It is causing harm to the environment as well as the economy. Okay, and we are going for the increase in the taxation. Then what is the loophole over here? So what are the challenges? Let's see. Weak enforcement of the existing laws. Whatever we have seen that 3-4 our you can say initiatives, there is weak enforcement. That is first. Second is the non-compliance with the packaging related guidelines. We have seen that there is these there are 33 sections which are related to the production, advertisement, and the distribution. Okay, so what are the you can say issues? So here main issue is that people are not going for the compliance. Okay, so the tobacco companies etc., they are finding loopholes in that and they are not going for the compliance when we are talking about the you can say guidelines related to the smokeless tobacco products over here. Now, ineffective regulation, smuggled tobacco products. Okay, so people are smuggling it from outside as well. Outdated fines. When we are talking about the violations, okay, as we have seen that in 2003 we have come up with that act, and now we are living in 2024. These fines are outdated. These are not up to mark. Okay, so that is also one challenge. Indirect advertisement through surrogate products. What are the surrogate products? Here let's see. In case of let's say if we talk about tobacco only, so in case of some kind of cigarette, okay, there is this company which cannot go for the advertisement of the cigarette. Okay, but the thing is they can go for the advertisement of pan masala. Okay, so what they do is they go for the advertisement of pan masala. Ultimately you will use this pan masala with some tobacco only. Okay, so that is where these pan masala that will act as a surrogate product over here. Okay, so you can go for the advertisement of the surrogate product and ultimately you will be promoting the cigarettes or the tobacco products indirectly. Otherwise, a simple example I can give you here is that we have Kingfisher. Okay, Kingfisher is a company which go for the alcohol production. Okay, so when we are talking about the liquors of the Kingfisher, they cannot go for the advertisement of the Kingfisher liquor. Okay, but they can go for the advertisement of the soda. They can go for the advertisement of the water products which are basically made by the Kingfisher. Ultimately, when there is a brand name which is created, so ultimately that will also have some kind of impact on the liquor sale as well. Okay, so that is basically indirect advertisement or the advertisement using the surrogate products. Okay, so that is about that. So that is also existing in the tobacco industry as well. Okay, now moving further, there are certain you can say policy recommendations which are made. Whatever challenges are there with respect to that, we have policy recommendations. Here you can say that stricter enforcement. We have said that weak enforcement is there, so we have to go for the strict enforcement. The second, increase the tobacco taxes. We want to reduce the use. We can go for the further increase in the taxes so that cost will be high. Then update penalties. Since we have seen that these penalties are age old, 2003, belonging to 2003. Now we can go for the updation of the penalties in case of violations. Okay. Now support tobacco farmers in transitioning to alternative crops, because this is having an derogative impact on the environment, and these farmers are having an income out of it. Okay, so until unless we provide them an alternative crop, okay, which can generate such remunerations, so we have to go for the change in the, or you can say alteration in the cropping patterns of the farmers over here. Okay, so support the tobacco farmers in transitioning the alternative crops. Continuous data collection to monitor trends and adapt strategies. So until unless we have the data, we cannot see that in which direction we are going. So that is why we need up-to-date data as of now. So as I told you earlier as well, the last data which we have, it is from 2019. After that, we did not have such data. Okay, so we can work on that as well. Okay, now moving to the last part, that is basically your conclusion over here. What we require is that we require a comprehensive and the sustained effort that are needed to tackle the tobacco epidemic. Epidemic, you know that this is a kind of spread of a disease in a particular area. Okay, now when we are talking about tobacco epidemic, we know that there are various diseases which are happening because of the consumption of tobacco. Now coordination of law enforcement, effective taxation, public health initiatives, and environmental conservation is essential. These measures can be mitigate the detrimental impact of the tobacco on health, economy, and the environment. That is the conclusion which you can use in your answer writings. Okay, now let's end the session with a MCQ practice. What is the primary goal of WHO Framework Convention on Tobacco Control, that is FCTC? Promoting tobacco industry growth, reducing tobacco uses worldwide, increasing tobacco advertisement, enhancing tobacco affordability. Okay, so this is the question. You can attempt this question and answer in the comment box. With that, I would like to wrap up the session. I'll see you in the next episode. Till then, have a good day. Thank you.
For more informative content, like, share and subscribe, and do not forget to press the bell icon to get the notifications.